Hi everybody and welcome back. It's Dr. Renee and this is part 2 of my current vlog on contraception. And this week we're going to cover the combined hormonal methods of contraception. And you might just think that's the pill because it's the one most people know. But there are actually some other things which are quite interesting in the way that they deliver the hormones. So hopefully I can shed some light on all of them for you today. So to start with, what is combined hormonal contraception? Well, it's contraception that contains both of the hormones estrogen and progesterone. Both of those hormones occur naturally in a woman's body. The progesterone in the combined method is actually a synthetic form of progesterone, and then the other hormone that we naturally have is estrogen. So how do they work? So we'll start with the pill because they're all slightly different. So the combined hormonal contraceptive pill works by thickening up the mucus at the opening to the womb, which is where a pregnancy would occur. And what that does is it makes it more difficult or impossible for the sperm to actually get through and enter the womb and meet an egg. But should a very brave and valiant sperm get through and meet an egg, it also thins down the lining of the womb so that it's actually not conducive to a pregnancy. It's thin and probably too thin for implantation to occur. So that's the theory behind it. You get packs of 21 or 28, and I'll come on to why they're different in a second, because in the main, you take a pill, a combined hormonal pill, once a day for 21 days, and then you stop. And you have a break for 7 days, and in that time your period will come, and then you start again on day 1, which is 7 days after stopping. So those are the packs with 21 in them, and that gives you the power to have the break and stop and have your period. There are, however, some options where we can give a woman 28 tablets, so she takes a tablet every single day for the entire year, never stops, never has a break. However, if you're on those tablets, you will still have your period in that 7 days, as if you'd taken a break, because those last 7 pills don't have any hormone in them, they're just sugar pills. And those are really good for women that won't remember to stop or start their new pill on the 7 days. So this way they can just carry on without having to think about it or plot it in a diary or anything like that. So there are 2 types, phasic and monophasic, and the difference between these is that the fluctuations of the hormones. So they can either be fairly standard all the way through, or they can fluctuate to more mimic your natural cycle. So you start normally on the first day of your period, that's day 1. And if you start on day 1 or any day up to day 5, you're protected against pregnancy immediately. If, however, you start on any day after day 5 of your cycle, you're not protected immediately and you'll need other contraception for about 7 days. So if you've just given birth, you can start the combined hormonal pill 21 days after you've given birth. But if you're breastfeeding, you should wait for 6 weeks. If you miss a pill, there are different rules depending on exactly when you miss them in the cycle and how many. But when you get prescribed the pill, your prescriber will go through these with you. And in terms of effectiveness, it's 99% effective against pregnancy. So really high, about as high as you can get. So what are the myths and side effects and risks of taking the pill? Well, it can definitely improve heavy or painful periods, and we often use it for that. It can help with premenstrual syndrome sometimes. It can help with endometriosis. It can, however, lose its effectiveness if you get diarrhea and vomiting. So that always needs to be borne in mind. There is no evidence at all on the pill that you gain weight. And I know lots of women say they do, but there is no evidence for it. My theory is you're in a new relationship, so you're happy and you're eating more. So it's happy weight. But obviously I have no evidence for that either. So side effects of the pill. So minor side effects that are often reported are mood swings, nausea, breast tenderness and headaches. Most of those will actually go after a few months. The nausea we can help by taking it on food, taking it at a different time of day. But those are the minor risks that we reported. A very low risk, but still a present one, is blood clots and cervical cancer, putting you more prone to cervical cancer. But those risks are very, very low indeed. There is of course no protection against sexually transmitted infections when you're on the pill, so if you wanted complete protection you would still have to use a barrier method of contraception, so a condom for example. It's not suitable for women who are over 35 and still smoke, so if that's you, you will not be able to have the combined pill. The reason for that is it puts your blood clot risk up too much to make it worth the benefits, worth taking that risk. If you've got certain medical conditions, so for example a migraine with aura, breast cancer in the family or you have had it, a high BMI, so your weight puts you into the obese category, you have heart disease, you have high blood pressure, liver problems or a history of blood clots, you won't be able to have the combined pill. There are lots of others as well, but there's a really good table that your GP will use to just check those things with you. Most people that we see can have it. Some medications also interfere with the pill, so your GP will speak to you about that. And the good news is that it seems to protect against endometrial, ovarian and colon cancer. So there are some side effects, but they're not massive, and there are so many different pills, we have so many to choose from, that if you're not getting on with one, it's always worth switching to another one to see if it suits you better. Slightly different type of progestogen, slightly different dose of estrogen may actually have an entirely different effect. So don't give up, trial and error sometimes is the way forward. And now we have the next method, which is the contraceptive patch. It's a sticky see-through patch that you put somewhere on your body, usually at the top of the buttocks, so it's hidden away. In the UK it's called Evra. You don't have to worry, it stays quite well. You can swim, bath, shower, play sports, go to steam rooms, so normal life continues. It works in exactly the same way as the pill, releasing estrogen and progestogen into the bloodstream. You have to change the patch weekly for 3 weeks, and then you leave it off for a week, and that's when you'll have your period. If you start it on day 1 to 5 of your cycle, you will be immediately protected against pregnancy. But if you start it after day 5, just as with the pill, you will need extra contraception for 7 days. It's more than 99% effective. There are mispatch rules, but your provider will talk to you about those because they're slightly more complex than the pill, and it depends when you've missed a patch or how long for. So what are the myths, risks and side effects of the patch? Well, they can help heavy or painful periods, just as the pill. They're not affected by diarrhea and vomiting, which the pill is, so that's really good. You don't get any weight gain when you're on the patch. It is affected by some medications, as with the pill. So again, it's not suitable for women over 35 who are smokers, have migraines with aura, have a high BMI, so overweight, have liver disorder, a history of blood clots or breast cancer, heart disease or hypertension. Minor side effects, you can get a slightly raised blood pressure. You can get blood clots, but again the risk is really tiny. The risk is greater if you're pregnant, just to put it into perspective. Some people get skin irritation from the patches. Same as the pill, you can get headaches, nausea, breast tenderness, mood changes, but these tend to settle, as with the pill. And again, it may protect against ovarian, endometrial and colon cancer. So very similar to the pill, just slightly different in the way that you use it. And then finally, there's something called the vaginal ring, which delivers both of those hormones to the uterus. In the UK, that's called NuvaRing. It's a small, soft plastic ring. It's very thin. It's only about 5 millimeters thick. It looks a bit like a piece of calamari, about this big. And you squeeze it in half and you pop it inside the vagina, and it sits there quite happily, releasing continual doses of estrogen and progestogen. You only use 1 ring a month, which is great, and it doesn't fall out. Occasionally it can, and you just pop it back. You leave it in for 21 days and then you take it out for 7, and that's when you have your period. It prevents ovulation and it thickens the mucus, just as in the others, and thins the lining of the womb. So you have the added bit here of it preventing ovulation. You can insert it any time during your cycle, but again, between days 1 and 5 you're protected immediately, but after day 5 you'll need an extra 7 days of contraception. You can't use it if you've had, as in with the others, a past history of deep vein thrombosis, migraines with aura, breast cancer, diabetes, if you're over 35 years old and you smoke, if you have liver disease, heart disease, high blood pressure and some other rarer disorders. It is more than 99% effective again. The other good thing in terms of the myths and the risks and the side effects is that it again is not affected by diarrhoea and vomiting. So that's only the pill. It can ease premenstrual tension symptoms. Bleeding is generally lighter and less painful. You can get a temporary increase in vaginal discharge, breast tenderness and headaches, but that tends to settle as with the others. So how do you decide? Well, again, I guess the most important question is, how important is it to you not to get pregnant? And these are all up there, all three methods that deliver combined hormones at the 99+% effectiveness. So that's as good as you're going to get. So from that perspective, they're all as good as each other. Will you remember it every day? That's really important. So are you going to need 28 pills in a pack? Is the patch easier from that perspective, or is the ring even easier because you just leave it there for 3 weeks? Do you have medical conditions that might be a contraindication and you can sort that out with your prescriber? Do you smoke? Are you overweight? Can you not use hormones for whatever reason? Do you not get on with them? So as in the part 1 of this, there's an excellent toolkit to help you work out which contraception is best for you. And I'll put that in the notes afterwards, so you can just go in there and program in all of the things that are important to you, and it will come up with its best suggestion for you. And it's from the Family Planning Association, so it's from a reputable source and it works really well, so I'd recommend that. So hopefully now you've learned something today about the combined methods, which you didn't know before, and it may now be that you have a choice that you didn't think you had. So please ask me any questions afterwards, as always. Make any suggestions for future vlogs, and if you want a contraception you can go to a local family planning clinic, just Google for that, sexual health clinics in your local area, your GP and even your pharmacy can sometimes counsel you and prescribe. So I hope that's helped, and I look forward to seeing you for part 3, which will cover the progesterone only methods, and again there's more than just pills. Okay, take care for now.